Let's now talk about the various phases of the chronic myeloid leukemia. We divide the chronic myeloid leukemia into three phases. Initial one is the chronic phase, then there is an accelerated phase, and then there is a blast crisis. Let's start by talking about median duration without the treatment. That will also give you an indication of which phase is the more dangerous one. Generally, if the patient presents in the chronic phase, and so there is a median age of around 5 to 6 years in the chronic phase. If the patient presents to us in accelerated phase, then the median duration of the lifespan is around 6 to 9 months, which is a drastic fall from the chronic phase. You can see that chronic phase is the one which is the most stable form, and this is the phase in which we have a very good treatment prognosis in the patients, and most of the patients, they generally present us in the chronic phase. But if the patient goes into the accelerated phase, the prognosis significantly declines. And it declines even further when we move on to the blast crisis. Anyone who develops a blast crisis or anyone who presents to us with a blast crisis has a very poor prognosis generally, and they have a median expected lifespan of around 3 to 6 months. Now, how do we demarcate these phases? This is important to understand. We demarcate them on the basis of the various components. What happens in the chronic phase is, as we are going to talk about in the symptom section, the patients are generally asymptomatic. So you basically, there are very few symptoms like the chronic fatigue, malaise, or just low-grade fever. So you do a complete blood count, or you do a complete blood count for any other unrelated disorder, and you see that there are a lot of white blood cells, and this is a disturbed picture of complete blood count. So can be an accidental discovery. And underlying, there is an expansion of the myeloid compartment. The myeloid compartment, the tumor is just starting to grow. It is starting to spread. And it's a very slow phase. It takes around 5 to 6 years to develop. And then afterwards, the patient can progress into an accelerated phase. What happens in accelerated phase is there are new cytogenic abnormalities. There can be the new chromosomal translocations. For example, there can be a new 922 translocation leading to the Philadelphia chromosome. That Philadelphia chromosome may not be present in the chronic phase of the disease. So there are new cytogenic abnormalities. The blast cells percentage increases as we move towards the right in this picture. And finally, we can have a blast crisis in which there is increased genomic instability. The genes become very much unstable. There's a very increased percentage of the blast cells. That signifies the blast crisis. Talking about the blast, in the chronic phase, generally there are less than 10% of the blast cells, which we can see, which generally classify it as a CML. The blast percentage is less than 10. If the blast percentage is greater than 10 but less than 20, we call it a myelodysplastic syndrome generally. So what happens in a chronic phase, which is a major presenting phase of the CML, that the blast is around 10%, not more than 10% generally. In the accelerated phase, there is an increase in the percentage of the blast cells in the bone marrow, generally around between the 10 to 20%. Now, a few guidelines say it is around 15 to 30%, but the WHO guideline, they say that it is about 10 to 20%. So I think that's the much more better guideline to follow. 10 to 20% in the accelerated phase, that shows that there is an acceleration of the disease. The blast component is increased, and increasing blast component signifies a worse disease or a worse prognosis. And when the patient goes into the blast crisis, so as the name blast crisis signifies that there is a large increase in the percentage of the blast cells. You can also say that when the patient is in the blast crisis, the CML has transformed into an acute leukemia, which has a very quicker onset of action, which is a very quicker onset, like it develops in around 3 to 6 months time. And it can either be AML or CML. Generally, it is more AML because it's a myeloid leukemia, but a few patients can go into the ALL as well. So that shows us that blast crisis is an acceleration of the disease. The disease started for the chronic phase, and then it moved on into an accelerated phase, which has a median duration of around 6 to 9 months. And then later on, without treatment, the patient can progress into a blast crisis. What are the symptomatology that is the hallmark of the various phases? In the chronic phase, patients are generally asymptomatic, or they will have very few symptoms like very low-grade fever, a slight minor fatigue, but generally they are asymptomatic. And it's generally in the chronic phase when we diagnose a patient, it is either an accidental discovery if we do a CBC for any other reason, or it's just for the patient. If the patient just presents to us with minor fatigue or minor symptoms, and if we do a chronic blood count, complete blood count, we can find out the CML and catch it in the earliest chronic phase. In the accelerated phase, the patients start developing increased tiredness. There is some component of the weight loss. And one important hallmark which signifies the progression of the disease is the enlargement of the spleen. Now, splenomegaly is a hallmark of CML. And when we talk about splenomegaly, we mean very huge spleen. The patients can have around, the spleen size can be around 15 centimeter below the costal margin. It can grow that long. So splenomegaly is a hallmark of CML, and when we have an enlarging spleen and the patient report of increasing weight loss and increasing anemia or tiredness, then we can safely say clinically that the disease is progressing from the chronic phase, or it has entered into the accelerated phase. And if the symptoms continue to go worse, if there is no treatment, then the patient can go into the blast crisis, in which there are increased blast cells in the bone marrow and in the blood. And also there is certain extramedullary disease. We can have generalized lymphadenopathy, we can have hepatomegaly, we can have metastatic disease with the mets going all over the body. It can go into the brain, it can go into the various parts of the body. So this is the continuum spectrum of the disease. The chronic phase, then the accelerated phase, and then the blast crisis. And we also base our treatment regimes on the various phases. Certain drugs act best in the chronic phase, certain drugs are useful in the accelerated phase, and then the last resort and the various drugs can be used in the blast crisis. So these were all phases of the chronic myeloid leukemia.